Good afternoon, everyone. It's 2:00. Thanks for joining us for today's briefing. On the panel today, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, and Kirsten Johnson, Commissioner of Health for the Milwaukee Health Department. County Executive Crowley, you're starting us off today.
Well, thank you so much, Sydney, and good afternoon to everyone. I want to start by acknowledging that this week is National Public Health Week. And while we, Milwaukee County, we don't have a health department, I do want to honor and recognize the important role our public health departments and health officers play in addressing the COVID-19 pandemic and really keeping our communities safe. Without their diligence and selflessness and ability to literally juggle rapidly evolving information on a daily basis this past year, we would not be where we are today. And so to all the public health department's employees, I want to say thank you. Your heroism and relentless dedication to keeping our community informed and healthy have not gone unnoticed. Today's National Public Health Week focus is on racial equity. And here in Milwaukee County, we've declared structural racism a public health crisis. When discriminatory practices in one sector of our society support corresponding practices in other sectors, they create an interconnected structure of inequities in laws and policies. And this is what we call structural racism. And we're seeing two destructive forces in structural racism and COVID-19 affect our communities of color during this pandemic. And there's a range of barriers to preventative care, like vaccines, that existed for people of color long before this pandemic. And we will continue to address and remove these types of barriers to achieve racial equity across Milwaukee County. But it's also National Minority Health Month, and this year's theme is active and healthy, something that I'm definitely partaking in myself, making sure to work out. But health is the key to progress and equity in other areas of life for our Black and Brown communities. So I want to invite you all to share information with your friends, your family, about why physical activity matters to you and the benefits of it. And this is just one way that we can improve and promote health equity on a local level. And as we talk about physical health, I want to share updates from our Parks Department. Our Parks Department is doing a fantastic job maintaining our many public parks for Milwaukee County residents as places to enjoy safely outdoors, especially with the recent stretch of spring weather, especially like today. And our county golf courses are beginning to open, and next month we'll bring the traveling beer gardens back to our parks. And I want to encourage you all to get out and enjoy our parks safely. And recently, a capacity change was just made to increase outdoor spaces capacity to 75% of their pre-COVID capacity. And this is a step in the right direction, particularly as we see vaccines continue to roll out and outdoor spaces continue to be one of the safest options for activities. And as you frequent the parks, we still encourage people to wear a mask, particularly as we're seeing cases rise locally and nationally. And this is concerning, but it's also a reminder that this pandemic is not over. And so as of yesterday, Wisconsin residents ages 16 and older are now eligible to receive the vaccine. The Milwaukee County Office on Emergency Management vaccination site at the Kosciuszko Community Center has next day appointment availability. And so I'm encouraged to report that we've seen an average of 200 to 400 vaccines daily, or been averaging 200 to 400 vaccines daily with a capacity of 3,840 per week at the Kosciuszko Community Center. And most of the individuals that we're seeing are from our 10 most vulnerable zip codes. This week, the county received 500 doses of Johnson & Johnson, which we are prioritizing for our hardest to reach and most vulnerable populations. And I want to urge every single one of you listening and watching to get the vaccine. We all play a part in protecting our communities and working towards herd immunity. I received the vaccine and I had no major side effects other than a sore arm. And so if you are concerned about the safety of the vaccine, please know that the data shows that it is overwhelmingly safe and effective. And we want you to make an informed decision regarding the vaccination. So please visit healthymke.com for more information. And lastly, I just want to remind folks that today is the Milwaukee County spring election, and I want to encourage everyone to go out and vote and remember that local elections have a huge impact on our day-to-day lives. And so if you're not registered to vote, please know that same-day registration is available to you at your polling location. So if you choose to vote in person, Please remember to bring a mask and practice physical distancing. You can visit myvote.wi.gov to check your registration status, find your voting location, and view who will be on your ballot. Again, the website is myvote.wi.gov. And with that, I'd like to hand it over to Mayor Barrett. Mayor Barrett.
Well, thank you very much, Mr. County Executive. Good afternoon, everyone. As the County Executive mentioned, this week is National Public Health Week. So I want to begin my remarks by thanking all our public health professionals who have been leading the charge against the COVID-19 pandemic. Public health workers across our nation have been working tirelessly for more than a year to test, to track, to treat, and to vaccinate against this virus. And I think for many of us, we really didn't have an appreciation for what public health is all about until about a year ago, because that was probably for many of us the first time that we were really exposed to the whole public health regime, if you will, or the public health world. But I can tell you from what I've seen over the last almost 13 months now, public health workers across our community and across our nation really have been working around the clock. They've been working in real time to craft public health orders based on science. And I'm proud that all of the decisions that we have made in the city of Milwaukee have been based on science. I think that that has been important, and we've been true to that since this began last March. But we've also seen a lot of collaboration across sectors to provide needed resources and to gather data on disease burden to guide decision-making. As the county executive also mentioned, I think coming to the forefront has been the structural racism that we saw early on in this pandemic, and we continue to do everything we can to combat that as well. So I am immensely grateful for all that public health workers have done to protect our families, to protect our community and our country during this extremely challenging time. So let's remember the public health workers this week. So it is baseball season, and I like that very much because I love it when spring is in the air. But with the start of the Brewers season, there will be some changes coming to testing at the American Family Field. As of next Monday, April 12th, days and hours of testing will move to Monday, Wednesday, Friday, and Saturday. Monday, Wednesday, Friday, and Saturday from 9 a.m. to 3 p.m. The location will also be changed. It will still be at the ballpark, but testing will be moved to the east parking lot. For those of you who know the stadium, or even if you don't, you're going to learn about it. This is the area that's designated as the Yount lot. That's as in Robin Yount, number 19, the kid who played many years for the Brewers. And that will occur later this week. Because of the game schedule at American Family Field, testing will not take place on April 14th or April 28th. So you can mark your calendars there, but look for that as we get closer to those two dates. But I really want to take a minute here and thank the Brewers once again for being such a great community partner. They have been fabulous partners in our testing efforts and now in our vaccination efforts as well. Yesterday, Brewers players began receiving their COVID-19 vaccines, and they took this opportunity as a chance to share their experience publicly and explain why they felt it was important to receive a COVID-19 vaccine. Their transparency and their openness will help lead the way for others. Our goal, obviously working with the Brewers, is we want to make sure that young people in particular and people who are coming from different backgrounds, just as the players come from different backgrounds, know that this is something they should do, that they should get the vaccine. And these are individuals who obviously are caring a lot for their bodies. Their physical condition is determinative of how much money they make. And so they're not going to do something if they think it's going to harm their body. And clearly we're seeing a lot of the players getting this vaccination. But in order to get it, we have to make sure that people are using our vaccination clinics. So moving forward, our health department community vaccination sites and North and South Division High School will be welcoming all residents of the city of Milwaukee, not just the residents from the priority zip codes. So all residents of the city of Milwaukee can go to North Division, South Division High School. The hours remain Monday through Friday, 10 a.m. to 4 a.m. To 4 p.m. until April 16th. And the big news this week, of course, I think as many of us recognize, is that vaccinations are now open for all Wisconsinites age 16 and older. And I want to encourage all residents, all city residents, all county residents, anybody in the state to take advantage of the ease of our walk-in locations to receive a vaccine, no appointment needed. So again, make sure that people take advantage of this. Finally, I want to make sure that we don't forget, because it's such an important part of our arsenal, is the Wisconsin Center. Over at the Wisconsin Center, working with FEMA, we are continuing to vaccinate large numbers of individuals safely and efficiently. I want to thank the United Way of Greater Milwaukee and Waukesha County for serving as our volunteer coordinator for the month of April and supporting our efforts at the center. Health is one of the key pillars of the United Way. In addition to supporting our vaccination efforts, the United Way has been serving our residents during the COVID-19 pandemic through continued essential funding and support programming. So we are very, very appreciative of all they do for our community as well. And with that, I'm going to turn it over to Dr. Weston. Thank you all very much.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we are currently seeing an average of 117 new cases a day and about 2 deaths every 3 days. It certainly is hard to believe a year has passed since we last recognized Public Health Week on this briefing. It's been quite a year, and we have come a long way in these 12 months. And that's in no small part due to the tireless and often thankless work of our public health workers in our 11 public health departments in Milwaukee County. We continue to see concerning trends with cases and percent positivity. Our new daily cases have increased by nearly 100% in the last 3 weeks, and our positivity rates are nearing 5%. And we're flanked by states on every side, Minnesota, Illinois, and in particular Michigan, that are seeing far worse numbers than we are. And if we've learned anything from this pandemic, it's that we do not live in isolation. Just as we are affected by strains developing around the world, we're also affected by trends occurring in our backyard. Now, as of yesterday, vaccine eligibility opened up statewide. That means that anyone age 16 and older can get vaccinated. And indeed, now is the time to get vaccinated. With the B.1.1.7 or UK variant becoming widespread in the United States and having increased contagiousness and increased severity, getting vaccinated now is the best way to protect yourself and your family. This variant, which is fast becoming the dominant strain of the virus, seems to be about 50% more contagious. And that means that you're 50% more likely to catch the disease from the same level of exposure today as you were several months ago. It also appears to be more than 60% more severe, more likely to cause hospitalization and death. So many of us know people who were sick with COVID back in the fall or the winter, or you yourself may have become sick. And quite possibly you had relatively mild illness from COVID. But if you get infected today with the new variant, you may be more than 60% more likely to be hospitalized or to die from that infection. This is a major reason why we're seeing younger people hospitalized across the country than we previously did months ago. And this is also why getting vaccinated now is so critical. The time to wait and see has passed. Over 100 million people in the United States have been vaccinated, and nearly 700 million doses of vaccine have been given worldwide. The vaccines are safe, and they are effective. The one thing that all the vaccines have in common is the efficacy against hospitalization and death. And each of the available vaccines has shown 100% protection against hospitalization and death. You don't want to be the person who gets sick and gets hospitalized while trying to decide if you want to get the vaccine. Vaccination appointments are available at our Milwaukee County Office of Emergency Management vaccination site at Kosciuszko Community Center. We will vaccinate anyone 18 years and older, anyone. And we have appointments available starting tomorrow. While we're open to everyone, we still want to promote equity in the vaccine distribution. And for that reason, we're reserving more appointments for zip codes that, based on the EVE model on our public-facing dashboard, are either high vulnerability or have low levels of vaccination. And we've expanded that priority group to 21 zip codes in the county. And those zip codes can be found at our site at covidmke.com. You can also register for an appointment there. So we are vaccinating everyone 18 and older at our site, but reserving appointments for those 21 zip codes in particular. And our site is by appointment only, and we'll get you in and out typically in less than 30 minutes, but North and South Division high schools continue to operate walk-up sites. And the Wisconsin Center and the South Shore Community COVID-19 vaccination site, to name a few, are both working to expand and add appointments. So if you're looking to get vaccinated, the best way to find a site near you is to go to healthymke.com, healthymke.com. They've put on a great new feature. You can put in your address or your zip code. You can see a map. You can see the websites, the phone numbers of vaccination sites in your area. Lastly, I talked recently about being an ambassador for the vaccine. If you've received the vaccine, talk to your family, your friends, your neighbors about your experiences. And if you're in the healthcare field, talk to your patients about the vaccine. I talk to every single patient I meet in the emergency department about the vaccine. It's amazing what a 2-minute conversation can do to clarify myths and help someone to promote their own health and their well-being through vaccination. So get protected yourself and spread the word to protect your community as well. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. Indeed, it is National Public Health Week, and I want to thank all of the Milwaukee Health Department staff who've put their lives on hold to fight this pandemic over the past year. I'm proud of the work we've done here in Milwaukee and that my public health partners in the county and state have achieved. Our gating criteria continue to show troubling trends. The rate of COVID-19 cases per 100,000 people is 94.9 in the city of Milwaukee, which continues to indicate substantial transmission. Additionally, our test positivity rate is hovering right below 5%. This is prompting us to continue to look at our public health order, and changes are possible in the next week. The changes that we have put in place would put us in the substantial transmission category, which is phase 5. This can be found on our website at milwaukee.gov/coronavirus/MMFS under updated gating criteria. It is very important that everyone continue to follow the safety steps to reduce the spread of COVID-19. That includes masks, distancing, washing hands, and avoiding large groups. Vaccinations are also how we're going to crush COVID. 11.2% of the city of Milwaukee residents have been fully vaccinated, and 22.4% have received at least 1 dose. We announced today that all city residents can come to the walk-in clinics at North and South Division high schools. The hours are Monday through Friday from 10 until 4. These sites will be open through next Friday, April 16th. Last week, we administered 1,538 doses at North Division High School and 1,940 doses at South Division. Our goal is to get as many people vaccinated as possible. As Mayor Barrett mentioned, hours, days, and location of testing in American Family Field are changing. Starting next week, the testing will be open from 9 until 3 on Monday, Wednesdays, Fridays, and Saturdays. Additional details, including days when the site will be closed because of Brewers game, will be updated at milwaukee.gov/COVID testing. The transition at Wisconsin Center is progressing smoothly. Yesterday, we did 1,000 first doses and 1,052 second doses. FEMA has increased its presence, which has freed up our staff to increase our vaccination efforts at churches, community groups, and libraries. City of Milwaukee residents, and specifically those 21 zip codes, are eligible to register at the Wisconsin Center. We open additional appointments every 3 days. Tomorrow we'll be open further for Thursday, Friday, and Saturday. I know there have been quite a few questions about the Presque Isle, the vessel docked at Port Milwaukee with confirmed COVID-19 infections on board. The Milwaukee Health Department has consulted with both the port and the ship owner, and we are confident that appropriate health precautions are in place. Some crew members have left the ship to quarantine in temporary housing. They are following appropriate precautions that were put in place by their trade association more than a year ago. And finally, I'd like to echo what Mayor Barrett said about our work with the Brewers. It was a true partnership. I appreciate the outreach efforts the team has made, and I'm hopeful that more people will choose to be vaccinated after seeing the players and their comfort with vaccine safety. Thank you.
Thank you, Commissioner Johnson. A reminder to the media, if you have questions, please place them into the chat. Our first questions come from Sharon Magenda. There's 2. The first is for Dr. Weston. Dr. Weston, Dr. Fauci says team sports are driving cases and not so much classrooms. What is your reaction to this? Do you agree? And is the younger population driving case increases in our area?
Yeah, so there's a few thoughts on this. I think one is that there appears to be, and the evidence is just starting to emerge here, but there appears to be a more of a preponderance for younger children with the B117 variant. So for the conventional variant, we saw that children were relatively protected, especially younger children. There weren't very many cases. Certainly they didn't become terribly sick in the vast majority of cases. That seems to be different with B117. We're seeing in certain states clusters of young children getting infected, not necessarily severely, but getting infected and continuing to spread in the community, certainly more with the conventional variants. So we'll watch for more data to come there. As far as classroom spread versus kind of the general out of classroom spread, we've seen that schools have been extremely diligent in distancing, in enforcing masking, in cohorting of students and changing the built environment to protect students. And so certainly when you go from a very protected space like the classroom to a less protected space, whatever that is, whether it's social gatherings, whether it's perhaps certain types of sports, there may be more risk of infection, but the same rules apply. Wearing a mask, keeping distance, having open air as much as possible, that certainly becomes easier now as the weather warms up as well.
Thanks, Dr. Weston. The second question from Sharon Bajenda is for Commissioner Johnson. According to DHS, the 7-day positivity rate a month ago today was 2.2%, and now it's at 3.4% for the state, a whole percentage difference. Is it alarming that Wisconsin is headed in the wrong direction? What are the plans with Milwaukee's health order?
Thank you. I wouldn't categorize it as alarming, but I'd say that we're concerned. And as Dr. Weston mentioned, if you look at the states that surround us, our bordering states, they have a higher number of cases than we do. So we are looking at our orders. As I mentioned, if you look at our website, you can see where we would be headed potentially next week if this doesn't turn around. I'm hopeful with the more people we vaccinate that we can stop and slow the spread of COVID as we're seeing it increase now. But I mean, yeah, it is definitely increasing and it is concerning.
Our next question comes from Rose Schmidt at CBS 58 for Mayor Barrett and Commissioner Johnson. Can you talk about opening up eligibility at North Division and South Division high schools? As a follow-up, is there a reason it isn't being open to people who live outside the city?
Well, not surprisingly, we want to focus on people who live in the city of Milwaukee with our city of Milwaukee Health Department workers. And later there's a question about the FEMA sites. The addition of the FEMA sites has really allowed us to be much more nimble and to bring the vaccinations into the neighborhoods, because what we want to do, we know that there are healthcare disparities in the state of Wisconsin and certainly in southeastern Wisconsin and Milwaukee. We want to make sure that we are bringing the vaccinations to those neighborhoods where people live. And I think many communities are going to have vaccination sites, but this clearly is one where we're intended to reach those populations that have historically been underserved by our healthcare system.
A second question from Rose Schmidt at CBS 58 for Dr. Weston, Mayor Barrett, and Commissioner Johnson. How have testing numbers been? As you're changing the days the site at American Family Field is open, are there places people can still get tested on Tuesdays, Thursdays, and Sundays?
I can comment on that briefly. Absolutely. There's many different testing sites throughout the county. The best place to find the testing sites, it's now all on the Healthy MKE website. It used to be Test Up MKE. It gets redirected. Either way, if you go to the Healthy MKE website, you can see all the testing centers throughout the county. There's public health sites. There's health system sites, community health center sites, private sites, all different sites listed on there. So many different places to get tested.
Our next question comes from Kent Wainscott at WISN 12. This is for anyone on the panel regarding vaccine equity and the 21 zip codes. How has the effort gone to increase compliance among minority communities? Is progress being made? Is it still a concern?
Well, I can comment on this initially. So the idea of the zip code program is to target highly vulnerable communities, and they're vulnerable for all sorts of different reasons. We have some preliminary data starting to come in to look at this. The vaccine data always lags a little bit since it has to be entered into the Wisconsin Immune Registry, but the initial data we're starting to see is promising. So in the week before the full implementation of the zip code program, that's when it was 10 zip codes, 25% of the vaccine went to those 10 priority zip codes. Now, so 25%. In the week after, close to 30%. So there did seem to be an increase. Now we have to continue to watch those numbers, continue to watch the trends through the EVE model and see how much of a dent we're making. But certainly prioritizing high vulnerability, low vaccinated communities will continue to be important for our community.
Our next question comes from Brittany Lewis at CBS 58 for Commissioner Johnson. What is the health department's role now at the Wisconsin Center?
So we are still managing the operations at Wisconsin Center. The health department is still responsible for overall operations. We are managing all the staff. We have a really close working relationship with the National Guard and FEMA. We have quite a few state and federal resources working collaboratively, and the health department is the one that's really coordinating the work. So we are still quite busy at the Wisconsin Center.
Thank you. Our next question is from Hillary Mintz at WISN 12. Dr. Weston, you mentioned the dangers of the variant. What is the biggest takeaway from the Dane County daycare outbreak?
So the Dane County daycare outbreak is one example, and it's hard to draw conclusions from one example without knowing all the details. Now, that said, it's one example in many that continue to emerge of increased cases of COVID in younger children. And so as I mentioned, we want to continue to follow the data here. We want to see large groups, large sample sizes to better understand, does B117 really affect children more? Is it more contagious among children? Are they more likely to be susceptible to it and to transmit it to others? And I think that data will be forthcoming soon. But for now, certainly cases like that Dane County case and others around the country are definitely raising alarms.
Next questions come from Allison Durth, the Milwaukee Journal Sentinel. First is for Commissioner Johnson. Does the outbreak at the daycare center in Dane County announced yesterday change any of the city of Milwaukee's plans in terms of when and how to potentially move between phases or its approach to schools and childcare centers being open?
So no, it does not change anything that we've planned or how we will move between phases. Many of our childcare centers have been open and they all have safety plans in place, including our schools. So we feel fairly confident about the mitigation measures that are in place, including with MPS opening. They are very rigorous. There's significant effort being given to making sure kids are masked, potentially even wearing shields, spacing, so distancing in the classrooms to assure that we can limit spread as best we can. And as Dr. Weston said, I think the situation in Dane County is an interesting case study, and I'm sure we'll learn more as time plays out.
This second question from Allison Durr is also for Commissioner Johnson. Given the announcement that FEMA will be supporting a mass vaccination site in Madison, is there any expectation that the 1,000 doses the state is sending to the Wisconsin Center would be reallocated to Madison?
No, we're not concerned about that at all. So the state is continuing to receive more doses of vaccine, and we are confident that we'll continue to receive the doses we've been promised for the Wisconsin Center and for our mobile sites.
Our next question comes from Ben Jordan at TMJ4 for Mayor Barrett and Commissioner Johnson. What is the biggest local impact of FEMA taking over the Wisconsin Center? Are additional Milwaukee Health Department resources going to North and South Division?
Well, really, that's what allowed us to make that move, was the fact that we had this additional help from FEMA that just freed up our staff and allowed them to move throughout the community, which has long been our goal. So we are extremely appreciative to this partnership with FEMA because it allows us to take the vaccinations to the people in different parts of the city.
Our next question comes from Ben Wagner at WISN 12 for Dr. Weston. With cases increasing, are local hospitals preparing for more COVID patients now? And if so, how?
So one of the, I think, most important things that was done early on in the pandemic was the partnerships that were formed between the different hospitals. Partnerships were already established between our hospitals, especially through the Milwaukee Healthcare Partnership. However, those partnerships, those connections were only strengthened. So from the chief executives, the chief medical officers, the operating folks, the testing leads, the vaccine leads, those meetings continue regularly, and our hospitals remain very vigilant and very prepared for any surges that would come.
Our next question comes from Sari Lusk at the Milwaukee Business Journal for Commissioner Johnson. How is the health department ensuring venues like American Family Field are enforcing mask use? A recent visitor to the ballpark reports a lack of compliance with the mask requirements.
It's a great question. So again, the mask requirement stands in our ordinance. It is also very clearly stated in the Brewers Safety Plan. We met with the Brewers earlier this week to talk about reinforcement. So one of the things that I think they did overall a fantastic job. And I can also speak from experience. I was there this weekend on Sunday. I attended the game with my family. I felt very safe. There was an individual in my section who was not masked and who was approached multiple times, and then I think eventually asked to leave. So I do think they're enforcing the masking quite well, but we did ask them to add additional sort of PSAs, potentially on the scoreboard, and more signage, so it's more universal. But overall, I think they did a great job of of enforcing the mask ordinance that we have in Milwaukee.
Our next question comes from Brittany Lewis, also for Commissioner Johnson. Are all 3,000 daily doses from the federal government going to the Wisconsin Center, or are some of those doses also going to North and South Division high schools?
So of the 3,000 doses allocated to the city of Milwaukee from FEMA, 1,000, so 1/3 can be taken off the top for our mobile clinics and sites. So we are using 1,000 doses from that allocation to North and South Division high schools.
Another question for Commissioner Johnson from Sari Lusk at the Business Journal. What do you mean by next week when you say the order could change at that time? Would that be Friday of next week when other orders have historically shifted?
It would be Friday of next week to follow the historical pattern we have set in place.
Next question is from Tony Atkins at TMJ4 for Dr. Weston and/or Commissioner Johnson. Do you believe the new variant of COVID-19 could be driving the increases in Milwaukee County? And if so, by how much?
I can start on that. So I think the answer is certainly. We see, I believe it's now 34 states in the District of Columbia, all with increasing number of COVID cases. So Wisconsin is certainly not alone. And I think in the vast majority of those, it's a multifactorial cause of why those cases are rising. But without a doubt, when we see the predominance of B117 among the variants, and that predominance is just growing and growing and growing, where at this point on a national level, it just continues to increase and will soon become, if it hasn't already, the dominant variant. I think it's you can't deny that is having a major effect, considering the increased contagiousness and the increased severity that new strain has.
Our next question is also for Dr. Weston from Mayan Silver at WUWM. With the possibility of the B117 variant impacting kids more, what's your advice for how people should interact with unvaccinated kids?
So I think the CDC guidance on that is actually very good. And so if people are fully vaccinated, they can interact with each other without precautions. So if you live in a household with your significant other and nobody else, and you're vaccinated, and your neighbors are vaccinated, them and their significant other, you can get together in a household without protection, presuming you're fully vaccinated 2 weeks out from your final vaccine dose. Now, once you start having kids in the mix, those are unvaccinated people. And so from one household, that's okay. So for example, if I do have kids, and so I can get together with my parents who are vaccinated and my kids, and we can all be in a household together. However, when I start going with relatives that also have kids that are unvaccinated, it's 2 different households. You don't want to mix those 2 together. And so really, you want to be especially cautious with kids. That's always been the case. But in particular now, as there's more unknowns with how the B117 variant is impacting disease contagiousness and transmission in kids.
Our next question comes from Allison Durr at the Journal Sentinel for Commissioner Johnson. How would you quantify how much the mobile units have increased since FEMA started offering support at the Wisconsin Center?
It's hard to quantify specifically. I would say it's allowed us significantly more ability to pivot. So for example, today, because we at both North and South Division today, because of voting, we were not allowed, we had to move out of the site, out of the field houses And initially had planned to just not have vaccine at those two locations today. But because we have more staff capacity, we were able to pivot, get tents in place, and have staff up while people are voting. So we didn't have any sort of break in our operations. Similarly, it just allows us a lot more agility. So if we get a call today from an organization that wants some vaccine on Thursday, for example, we are able to do that. We're able to pivot much more quickly because we have staff that are available to do, a larger clinic at any given time. We schedule those generally more in a week or two in advance, but also sort of these smaller one-off clinics. We're calling them pop-ups, but we're able to do a number of those a day too.
Our next question is from Ben Wagner at WISN 12. Locally, what age group is driving increases in cases? Do we know of anyone who has been vaccinated who has tested positive?
As far as age groups, there doesn't seem to be one age group that's clearly driving any sort of increase at this point, but that's data that is in our dashboard, and we certainly continue to follow each day. As far as anyone who's been vaccinated and tested positive, it does happen. I've heard of a few cases. The cases I've heard of are very mild disease. Certainly nobody that became severely ill, but it's rare. We know the vaccines aren't 100% effective in preventing any sort of symptoms. So some people do get mild symptoms still, but it's rare.
Next question would be for Commissioner Johnson or Dr. Weston from Drake Bentley at the Journal Sentinel. Are we beginning to see a new peak for Milwaukee and Wisconsin in cases?
I think we're starting to see a new increase, certainly. Whether that increase ends up being a significant spike like we saw back in November or a smaller blip on the radar is to be determined. I think it's to be determined by a lot of the unknowns that surround the new strain. I think it is to be determined by how much caution people take with masking and distancing. And it's in particular to be determined by how fast we can get people vaccinated.
Our next question comes from Madeline Anderson at Fox 6 for Dr. Weston. What would be your best guess as to why the UK variant appears to be more prevalent among younger children?
I don't know that I have a best guess there. There's a lot of very smart people all throughout the world working on that, so I'll keep you updated.
Our next question is from Me Wisconsin News for Dr. Weston. Dane County reported a daycare with the new variant that leaves 37 people infected. Is there any plan in place for daycares in Milwaukee?
That might be a question for
Commissioner Johnson.
So all of our daycares that are open do have safety plans in place. I don't, again, know the circumstances of what occurred at that daycare in Dane County, but we do have safety measures in place in all the daycares in the city.
Thank you. It looks like we're coming up on one of our last questions in the chat. If there are any further questions, be sure to pop them into the chat and we'll get to as many as we can. The next question is from Rose Schmidt at CBS 58. What is the city and county's guidance, if any, to employers who want to mandate the vaccine for their employees?
I can jump in here. I think I certainly would take the approach of education first. I think all of us are very cognizant that there are remnants of cultural wars that are at place here going on right now about vaccinations. But I think the more we can educate people about the efficacy of it and the safety of it, the more compliant people will be. And when I say compliant, I think that they'll volunteer to do it. So the experience we have had is not surprisingly, just given human nature, when it was new, there were, I think, a number of people who said, well, I'm just going to wait and see. As more and more people get it, I think that they're understanding that it's safe and it not only protects others, but it protects themselves as well. So I'm very much of the school of thought, let's continue to educate and see where we go from there.
And I couldn't agree with the mayor even more. We have to continue to educate everybody out there. I mean, this is a choice that people have to make for themselves and their families to keep everybody around them safe. So we have to continue to educate and let people know, but also tell your story. If you have been vaccinated, let folks know and tell your story so we can continue to encourage people and get as many people with shots in their arms.
Our next question is from Allison Durr at the Milwaukee Journal-Sentinel. The city's key performance metrics show high transmission in the rate of COVID-19 cases per 100,000, but low transmission in the percentage of test positivity. Can you explain why they appear to be contradictory? For example, is the city experiencing low transmission or high transmission? And how these two metrics then inform moving between phases when they don't align?
Sure. So these are just two different metrics. And we actually took them from the CDC and used their framework. And the CDC's guidance and is to follow the highest of two metrics. So we would follow in this case, the burden, so cases per 100,000 in terms of our guidance around orders. But again, they're two different metrics. They may not always align, but we'll always follow the higher of the two.
Thank you, Commissioner Johnson. That appears to be our final question for media. Last call for questions. All right. Thanks, everyone, for joining us today. We will see you back here again on Thursday.
Thank you all.
Thanks, everyone.
Thank you.